Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at ACES. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to providing the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome, right? Yeah, we all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro Website Pro, Tony Seymour. He's a professional web designer, and his team at the Chiro Website Pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the number one hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com. and make sure you ask them about the special ACES discount and let them know Dr. O sent you. You'll be glad. You did.
Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
What exactly is animal chiropractic? You know, we hear all the time, people ask us, how can I tell if my dog needs to go to the chiropractor? How to tell if my horse needs to go to the chiropractor? Well, one of the things that we know, just even as basic human beings, is that if an animal has two legs, two eyes, two ears, two sides, okay, and we don't know really how they should move, if this is full range of motion in my left arm, then if you check my right arm, it should be balanced and symmetrical. All right, so man, that's just not going to be balanced and symmetrical. So our goal with animal chiropractic is to get balance and symmetry. Now, we can get that, we restore the movement. But how long will the animal be able to hold their adjustment? Sometimes weeks, sometimes months, sometimes a day. That depends on what else is going on. One of the things that we look at when we adjust animals, or that I look at when I adjust animals, is I will measure the circumference of the leg. Because if the animal is balanced and symmetrical, both thighs will be the same. Both forearms will be the same. Okay? Doesn't matter what animal it is, if it's balanced and symmetrical, the arms should be equal. The legs should be equal. If they're not, then we need to do maybe some target exercises as well as restoring nerve flow. Because one thing we know about quadruped movement is it takes every muscle, every bone, every ligament, every joint in the body to move one step. Not like us, we can walk around with one arm, in a sling. Really doesn't affect our overall movement very much. Our dogs, our horses, man, if they have one leg that's not moving properly, their lameness becomes very obvious. We've got a couple dogs that come in that are three-legged. How often they need adjusted? Well, about every week, and they still don't hold their adjustment very long because there's no way that they can be balanced and symmetrical. So if your dog is balanced and asymmetry, anything that's causing that, we know that stimulation of the brain, when you go out in the bright lights, both eyes are going to work, both ears are going to work. So what happens if your horse is blind in one eye? Your dog, is blind in one eye or deaf in one ear. What's that going to do to the stimulation in the brain? Well, it's going to cut it way down. Be a huge problem. And so one of the things that we do is send home some exercises. Had a dog in here the other day that started care about a little over a month ago. Had a limp that was coming and going and not really very obvious. Difficulty pinpointing it. Ended up being an atlas subluxation and some pelvis subluxation, and we adjusted those. But on the first visit, we went ahead and measured the thighs, and we had an inch difference between the two thighs. Now, that helped explain to the owner why that dog wasn't going to hold his adjustment for very long and what was happening. The dog was blind in his right eye. So the owner is stimulating the right side of the brain 3 or 4 times a day just by snapping in his ear. Snapping in that right ear, stimulating the right side of that brain just a little bit more. And after 30 days, just with no target exercises, just increasing the neurological input to that right side of the brain, we only have a ½ inch difference. Okay, so these are some really big things that we need to look at. How much muscle atrophy do we have in these animals? That's going to help us determine how long your animal will hold this adjustment. There's 2 ways to get muscle atrophy. One is non-use. Takes about 7 weeks to see a noticeable difference. The other is loss of innervation. Takes about 7 days to get a noticeable loss with loss of innervation. We don't ever have complete loss of innervation, hopefully. Subluxation is just going to restrict that innervation. As an animal chiropractor, we're going to go in, remove those subluxations, remove that nervous system interference, and allow your animal to perform at optimal levels and hopefully become bilaterally symmetrical. Have a great day. Keep them adjusted.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Hey, just a quick reminder, we have several events coming up soon. We have the advanced Atlas adjusting for dogs coming up in March. We have the advanced Atlas adjusting for horses coming up this summer. And then, of course, we have our food animal coming up in the fall. So go to the website, www.animalchiropracticeducation.com. Take a look, find those things, sign up. If you're not already certified, then you want to take Animal Chiropractic 101. That starts the day you sign up. You can become certified if you're a veterinarian or a chiropractor. You can become certified in as little as a couple months. So go ahead, take a look at the website, and thanks for tuning in.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hey everybody, welcome to another episode of Animal Chiropractic Clinic Chatter. And we have a special guest with us today from across the pond, and not the little pond, the big pond. Tell us a little bit about yourself, Dr. Opperman.
Hello everybody. I am a chiropractor, and then I enrolled in the ACES program, if I'm correct, 2 or 3 years ago. If I'm right, that's when I qualified, and I did the AVCA exam as well. And well, actually pretty good news is that I got South African Vet Board registered this week. So we are taking animal chiropractic to Africa. So that's where I am based, and that's where I work from. So it has been a life-changing experience, and we are changing lives.
Cool. So
yeah,
let's talk about those things independently. So first off, you're in South Africa.
Yes.
Chiropractor, did you grow up there?
Yes, I grew up in South Africa. I'm born and bred in South Africa.
Okay. And why did you decide to be the first AVCA certified chiropractor in South Africa?
It's actually quite crazy. Like a lot of my equine clients ask me, I don't even ride horses. I think I've ridden a horse maybe twice or 3 times in my entire life. I think the big reason was to better my practice and to be more diversified. I just opened up a complete new business sense and knew how to do business in South Africa, and I've never looked back. I actually told my wife the other day I must have done it the first year when I started practicing. Why did I spend 10 years not doing this? This was a thing that was out there and I never knew about it. So yes, so that's why sometimes I tell people I feel like a prophet. I go all across Africa and just spread the word of animal chiropractic. So yeah.
All right. Cool. That's what we like to hear, because, if we can, BJ said, you never know what you say or do today, how many people that's going to affect in the future.
No, definitely. That's the truth.
And that's one of the reasons that Dr. Amy and I teach, is because we know that we can't adjust all the animals that need to be adjusted by ourselves.
Yes.
And so, now you're over there in South Africa adjusting animals. Talk to me about the vet board.
So it took us some time. So again, I think everything just fell into place with me, is that I didn't know where to go and who to go speak to. And just by hook or by crook, I ended up at a lady that's a vet herself, that she does a lot of animal rehabilitation. So she doesn't practice veterinary medicine like she used to, where she would just inject, and she has a complete rehab center. So she does a lot of hydrotherapy, as well as what we'll do with normal human athletes. So I somehow got to her, and she was actually the head of this rehabilitation part of the vet council. So through her, I could get to the right people and got registered with the vet council now. So there are other chiropractors in South Africa that say that they can treat animals and so forth. So luckily there were 5 other chiropractors that they studied in the UK. I don't know exactly where they studied in the UK, and they are also doing animal chiropractic here. So I told them about what I think we should do, and so we sort of 6 banded together and then we all 6 of us got registered with the Vet Council in last week. So yeah, so now legally we can treat animals without having issues, as well as then obviously things like this malpractice insurance, and you get a practice number, and for medical aids, for animal medical aids, they can claim now because we have a practice number.
Cool. All right.
Yeah.
So, and is it fairly, so what do other, like, new animal chiropractors need to do to be registered?
So it's still pretty early days. So I think in the next week or so, I'll get together with them and send them out an email and just ask them exactly how we can get other people to join the program, because my biggest issue at this time of the fight is that I need another one of myself. So so I'm actually starting with maybe like a mentorship program where we can get funds together, send them over to ACEs, let them do the program, because that's one thing that I've noticed as well, is that I have worked a little bit with the other chiropractors, and the way they approach it, I'm not 100%, I don't agree with it 100%. And I do believe that the results that I'm getting is not just because of me being myself, but I think because of my training. So I do believe in a lot the way that ACEs approaches the whole thing, and it's just a bit different. So it makes you unique, and the results speak for itself. So we are busy with a mentor program where we want to send people over. Obviously with Corona and things like that, it's a bit difficult right now, but that, in the other sense as well, it helps a little bit, because I am given time a little bit just to get everything in order, exactly how we are going to go about it. The detail is we still have to figure out the details.
One thing that we're doing because of Corona is in May, we have 1, 2, and 3 weekends in a row.
Okay.
So we have some Canadians coming in. And so they'll only have to quarantine 14 days total.
Yes.
They'll spend some extra time here, only 14 days when they get home, instead of 14 days 3 times. It means 22 days less of quarantine for them.
Yeah. So what's happened is I was supposed to travel to the States in March for the UFC, but as your president closed the borders for South Africa. So South Africans aren't allowed to go anywhere in the world right now, because they say that the second strain originated here. So we have to stay put right now. So yes. So we have a bit of a mission.
So yeah, and so what's happening is we're getting people signed up, and they're getting the online stuff done out of the way, so that as soon as stuff goes, boom, we can get it done. Yeah.
I need to find a chiropractor that's willing to do it as well, because a lot of like European countries have come and stolen a lot of our chiropractors. So we are like we're far in between right now in South Africa. But I've got a vet friend of mine that I've met through the process that she's very interested, or he's very interested to go into that sort of line and see what we can do from there.
Well, cool. All right. So, hey, tell me what your biggest win is with animal chiropractic, besides it's changed your life.
No, it has. It has changed my life, my family's life. I think a big thing is where the normal traditional veterinary medicine, there's nothing wrong with it. I do believe that there's a place for it. But I do believe my big thing is where I've sort of found my niche is more in performance animals. So pretty high-end horses that jump Grand Prix level, or with the racing industry. So I'm busy with rehabbing a racing horse. He's about 4 years old. They actually wanted to put him down, and I said to the lady, let me just have a look at him, and I'll treat him for free for a month. And I'll think he's had his, to give you a bit of an history, is that he won quite a lot of races, and then suddenly just came dead last. So for no obvious reason, he wasn't necessarily lame or anything like that. So I've worked with him for a month now, and I think he had his first race last week, and I think he came third. So from a horse that was about to be put down to he'll have another at least 2 or 3 years in his career. So the other day, I think in the week previously, somebody asked me to come have a look at the goat. So that was a pretty interesting challenge just to try and figure out. See, that's why I like the ACES program, because you get the bases, and because of what they've taught you, you can sort of play around with it. So now I was thinking about this goat. Must I adjust it like I adjust a dog, like I do a horse? Because you can feel the joints move, and you can sort of make a plan and work around it from there. So we'll see now. I don't think they're going to put him on the fire right now. He's not going to be eaten right now. I think he still has some time left, because he's they use him to breed with. So he's a breeding goat. So and he struggles to mate with the females. He can't jump up because he's sore. So we'll see in the next couple of weeks exactly how he goes. And a friend of mine owns a. Sorry, I'm going on a tangent.
No, it's great. Keep going.
A friend of mine owns a it sounds terrible, like a petting zoo, but they have wild cats, and he rescued a cheetah. But the cheetah had a torn cruciate ligament. So we're working with the cheetah as well. But we need to get the vet in so that the vet can sedate him a little bit, because I don't feel like being munched or being scratched by a cheetah right now. So that also has its challenges. So I must say that's where my life is right now. So I can show you guys quickly where I am. Just hold on a second for me. So I'm actually next to the coast. So you'll see the coast down there. So I'm actually traveling for ponies. So I'm only going back home on Monday. So I'm doing a whole trip down the coast of South Africa treating horses.
All right. Cool.
Yeah.
So, all right. So what do you wish all the animal owners in your area knew about animal chiropractic?
I just think that instead of putting a whole bunch of drugs down the throat and taking their life, I won't say destroying their lives, but you can, with chiropractic, we can fix them. We can honestly fix them. We can fix them without having an operation. We can fix them. Remember, if we fix a dog, he needs to be cage raced for 6 weeks, and that's like the worst thing you can do for a dog. Or horses that have to be put down, or any animal that's to be put down, we can fix them. We can honestly fix them. If you give us enough time and you be patient with us, and you trust us, we can fix them. We can increase their lives. We can just make their lives so much better. So I do believe it's once you can, the results speak for itself. That's I always tell people, even if I have to see the animal free for the first time, it's fine, because I know the results will speak for itself, and you will tell all your friends and all your family about what's.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you. Welcome to Dr. O's opus of animal chiropractic. Chiropractic consists of 3 parts: the art, the science, and the philosophy. This last segment of today's podcast is loaded with the philosophy and principles of animal chiropractic.
So after some time traveling this, I realize how important it is for us as animal chiropractors and utilizers of chiropractic care, how important it is we talk to everybody. As veterinarians, we have a tendency to say, oh, I'm not going to tell people what I do for a living because I don't want to hear about their dog and I don't want to hear about all this stuff. But as animal chiropractors, we have to teach people what it is, whether they're going to be our clients or not. You know, I cannot tell you how many people on a day-to-day basis say, oh my gosh, it's really a thing. Animal chiropractic, I've never heard about it. So, you know, and we see all the time, you know, I saw a dog this weekend, pictures of a dog, sorry, because I was not where I was licensed. I didn't touch the dog, but I referred it to an animal chiropractor in the area. This, you know, the waitress is like, oh my gosh, what about this kind of surgery? I'm trying to save money, you know, for $6,000 worth of surgery on my dog's knee, and try an animal chiropractor. What have you got to lose? You know? Oh, what? Why? So anyway, talked about animal chiropractic. Guess what? Now she's looking for a chiropractor for herself, and she's looking for a chiropractor for her animal, because she believed in health, that health was not medical care, that there's a difference between being healthy and going to the doctor. I mean, I just read a thing the other day that Dr. Fauci says there's a new coronavirus out that is undetected by the current coronavirus tests, and there's no symptoms. So you test negative and you have no symptoms. Isn't that kind of being healthy? So doesn't that mean your immune system is working properly? One gentleman I talked to wanted to know where we lived. I told him we lived in Texas on a ranch. He said, oh, I got a buddy that has 1,000 cows, blah, blah, blah. I said, yeah, we do animal chiropractic, and we not only do dogs and horses, but we do food animals. And he was like, oh my God, yes. He said, I'll bet they taste better, don't they? Because, you know, there'd be less stress and all kinds of things like that. And I was like, yeah, that would be why we would adjust our food animals. He said, man, he said, that'd be so cool. And I thought he got it. I never really described much else to him. And then the next day I saw him, and he's, how you doing today? He says, oh, well, I'm a little sore. I got my first shot the other day. And I'm like, oh my gosh, a shot. That's the opposite of chiropractic. Chiropractic is above, down, inside out. Anything we inject or put in the body, you know, not only does the body have to heal from that problem, whatever the disease is, but we got to take care of that poison that got put into, because none of us were born with a vaccine deficiency. None of us were born with an antibiotic deficiency or a steroid deficiency. You know, we're all have problems due to the inability of the body to communicate with itself. You know, allergies are just an immune system that's not working properly. Fix the immune system. Don't cut it down with steroids. You know, let's see what's going on. Let's make sure that the body is able to handle and adapt to changes. That's what chiropractic is about. That is why we adjust animals. It's about adaptation. It's about allowing the body to adapt to its environment, okay? Make appropriate adaptations. Now, sometimes do we need medical intervention? You bet, you know, because sometimes we have to allow the body time, you know, to make these changes because we've had a severe trauma, or we've, you know, allowed things to build up over time, you know. If you're hit by, you know, if you got a hit by car dog with a broken leg, yep, you need to heal that leg. You need to see an orthopedic surgeon. But by the same token, you need to get that dog's atlas adjusted. You need the rest of the body to be moving properly so that he can adapt to and heal appropriately. He can't be thinking, his body can't be worried about, you know, hey, do I have the right nutrients? You know, what kind of communication is going on? So chiropractic, allow the body to heal from above, down, inside out. As utilizers of chiropractic and animal chiropractors, we have to tell everybody, we have to work on our elevator speech. We have to be ready to tell people why animal chiropractic is a thing, why animal chiropractic works. You know, how easy is it to ask a dog, you know, to tell somebody there, you know, turn your head to the right, turn your head to the left. Look, you can't turn as far. That's because your neck is out of alignment. Imagine all the nerves that go through that place. Imagine how much trouble you're actually seeing in those things. So animal chiropractic, your dog is having problems. Why can't he catch the frisbee? Why isn't he jumping as high as he used to? Not jumping on the bed, not jumping off the bed. All these things. Yeah, there might be radiographic changes. We might have a diagnosis, a veterinary diagnosis. We see things all the time about that. But the chiropractic diagnosis is a vertebral subluxation. It really is a thing, and it is enough, okay? Because that vertebral subluxation creates problems with communication from the brain to the rest of the body, okay? Especially the atlas, that first cervical vertebra. It controls lateral flexion of the head and neck. It controls flexion and extension of the head and neck. Huge. You got to make sure the space between the ramus of the mandible and the wings of the atlas is even. That dog can laterally flex. That horse can laterally flex. Keep his eyes level on the horizon, which is the number 2 priority of the nervous system. We don't worry about it very often, but it's huge. Keeping those eyes level on the horizon. Because if we can't see the predator or the prey, we're not going to last very long. If we don't see the prey, if your dog doesn't see the prey, he'll go hungry. If he doesn't see the dog that's bigger than him or the lion, he ends up being lunch. Same way with your horse, okay? It's the way it is. We have got to help these animals maintain their neurological priorities and survive. That gives them more time to heal, more time to be a better animal and create the companion that we want them to be. Create the companion that allows us to go for nice walks, or the companion that allows us to win in whatever event we do. So keep your animals adjusted. Tell people why chiropractic is important. Be empowered in the body's ability to heal from above down, inside out, and you'll never be disappointed. Thank you. Have a great day.
Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.